All right. Good afternoon, everyone, and welcome to another webinar Wednesday. My name is Bill Gazelle, and I'm here in the Saskatoon office. And today we've got some information for you on exposure control plans. But first, I'm just going to introduce our other panelists for today. Kieran.
Hi, everyone. My name is Kieran Greening. I work out of the Saskatoon office as well, but as you can see, I'm not there at the moment. I'm working from home. But I deal with some regions, Prince Albert, out west to Macklin, and east to Humboldt.
It's a big area. So my name is Mike Moore. I'm safety advisor out of Saskatoon as well. I take care of Lloyd, Battleford, Meadow Lake, that kind of area, and then also in Saskatoon as well. So
I'm glad to have you two on board with this webinar today. I think it's something we've mentioned in the past in passing in other webinars, but to do a focused approach to it today, I believe is not only timely, but also important to those that are going to be watching today and those that are planning to move forward with the development of an exposure control plan. So without too much further, I'm going to jump into the PowerPoint. All right. So as I said, today's discussion is going to be about the development and the implementation of an exposure control plan as well. Of course, this is December 9th, 2020. And here we go. Just before we get going, a few things that I wanted to talk about is some of the services and activities that the SCSA is doing right now, both during this pandemic and also into the future. Right now, you can catch us live as we are today every Wednesday for a webinar Wednesday, where we're going to bring forward a topic of discussion and have a little bit of a chat around it, share some information, and hopefully provide you, the viewers, with something useful that you can take forward to help your organization not only deal with situations that are arising today, but those that may come up in the future. As well, every Tuesday, we're running a toolbox talk live and online. I would hope that you join in. There's been some fantastic topics in the past few weeks, and it's a good opportunity to share that information with your workers. So if you happen to be sitting in the lunchroom trailer or otherwise at your coffee break on a Tuesday, join us, log in, and get some good information. A lot of it is very timely for the season, very timely for the activities that you may or may not be doing at your place of employment. And again, a good opportunity to increase that worker level knowledge. A couple of the other things that we wanted to talk about is those toolbox talks are also available not only off of our website from the resource tab, but as well, they're also accessible through our app. So if you haven't taken the opportunity now, I would suggest that you go onto the Play Store or onto the Google App Store and download a copy of the SCSA's Guide to OH&S Legislation. It's a very, very small download, but an incredibly powerful tool. Not only does it give you information based upon topics that lead you to, as you see here on the slide, stuff such as confined space, fall protection, first aid, but it also links you to the PDF copies of the toolbox talks that correspond to those topics. So again, if you're sitting on a job site and it's a Tuesday and you're looking for something to share with the workers, some new information, download the app, work your way into one of the topics, download the topic, and present that to your workforce. It's a great opportunity. It's a great tool for sharing, and also a great tool for answering some questions that workers may or may not have about certain items going forward. Also wanted to talk about the SCSA's instructor-led online training. Currently, we have 12 classes offered online. They are regularly scheduled. They are accessible through our website. So if you go into our courses tab on our website, it'll bring up the information, the calendar, and the schedule, and the availability of those 12 classes. The 12 classes, a lot of them are focused around core implementation. However, we do have a number of the practical application classes as well too. Just recently, I transitioned out of providing fall protection in this online format, and it's actually running today with one of our training technicians providing that information. It is a very, very good class. You are not getting shortchanged in your training in one way at all. By taking these through the instructor-led online, you are still receiving the exact same class you'd be receiving as if you were sitting here in our building, plus the accessibility. You can access this information from your home, from your office, or otherwise. Great opportunity to get some of that training in. And then talking about some of the services that myself and the two other panelists and a number of our other staff provide, which is advisory services. Now, the picture here shows us doing a live interactive demo, which of course is on hold currently, but we do have pre-recorded demos that we can share with your workforce. As well, our advisory service staff is here to help answer some of your questions moving forward, whether it's in certification, program development, or if you just have any questions even about the topic that we're going to be speaking about today. So once we've run through a little bit of the information about advisories or about the exposure control plan, feel free to reach out to us. The information, our numbers are accessible through the website, through email, and somebody would be happy to return your call or email at a very, very convenient time and give you that information or help you navigate some of not only the stuff, as I said, we're going through today, but if you're planning for developing a safety management system for the future, whether you're wondering about training opportunities or otherwise, feel free to reach out to advisory services and they'll be happy to assist you with some of your questions moving forward. The last piece that I wanted to talk about is the accessing our information, not only just COVID-19, but also other safety related resources that I mentioned previously from our website. It is very accessible, it's very easy to navigate, and not only are those toolbox talks and contact information located on there, but there is also a large availability of resource information that you can take advantage of to, again, help you develop your health and safety programs. There's sample forms, not only, as I said, COVID-based, but also just your site operations, hazard assessment documents, all sorts of stuff available through our website. So please take time to check into it. It is at, of course, www.scsaonline.ca. So today's topic, exposure control plan. And we're going to talk a little bit about the implementation and the development of that exposure control plan based around the information that we find in Regulation 85. So a few things as we move forward with this information that when we're talking about Regulation 85, of course, found in the Act and Regs, if you do not have a copy, a physical copy of the Act and Regulations in front of you, you can use your favorite search engine to look it up, and you can download the PDF version of this. The PDF version downloads to your phone storage or to your device storage, so you can access it at any time. And it gives you a real nice up-to-date look at what the current regulations state. One of the issues sometimes we encounter is that employers often have older copies of the Act and Regs in their building or in their facilities, and they haven't moved up to the most recent or current version. So by downloading the PDF, you're guaranteeing yourself that you are getting the most up-to-date information on the regulations, the Act, and that information going forward. So Regulation 85, I broke it down into a few different slides to try to make it more bite-sized. It is a fairly large section. The exposure control plan and the information found within that regulation includes approximately 2 full pages worth of the actual Act and Regulations itself, physical pages. So we're going to try to put it into some bite-sized chunks, and we'll have a little bit of discussion about how to implement this following the review of the regulation. As with any regulation, it's important to understand the terminology used within that regulation. There's a number of statements and terms that are referenced as we read through it. And without that foundation of what those terms are referencing, it's a little bit difficult to understand exactly what that regulation is speaking to. So one of the ones pulled from 3-29, it is the definition of an employer. It is a person, firm, association, or body that has, in connection with the operation of a place of employment, one or more workers in the service of the person, firm, association, or body. When we get into Regulation 85, right near the start of it, it starts to define a couple of the other terms that are more applicable to that specific regulation. The first one being expose. That means harmful contact with an infectious material or organism from inhalation, ingestion, skin or mucous membrane contact, or percutaneous injury. The exposure control plan that is identified in there will be expanded on further as we get into the regulations, but it means an exposure control plan pursuant to subsection 2, which we're on to in just after these definitions. It also defines the term infectious material or organism, and this means an infectious material or organism that has been identified in an approved manner as an infectious disease hazard that poses a significant increased exposure risk to a worker or self-employed person. That subsection 2 that was mentioned in the previous statement starts off in, if workers are required to handle, use, produce an infectious material or organism, or are likely to be exposed at a place of employment, an employer, in consultation with the committee, shall develop and implement an exposure control plan to eliminate or minimize worker exposure. So that's really what we're talking about today, is the development and the implementation of this plan. The components of this plan are also laid out throughout the regulation. The exposure control plan must be in writing. Along with a number of other plans that are found throughout the regulations, these need to be documented. This can't be something that's just discussed in general conversation with the workforce as part of a toolbox talk or a safety meeting, just inclusive. You need to have a documented, completed plan. That plan must identify the workers at the place of employment who may be exposed. It must also identify categories of tasks and procedures that may put workers at risk for exposure. Also, it must describe the ways in which the infectious material or organism can enter the body of the worker and the risks associated with that entry. And in that document as well too, it must describe the signs and symptoms of any disease that may arise for a worker exposed at that place of employment. The next step of that is in there, it must describe the infection control measures to be used, such as the following. So whether vaccination or engineering controls are going to be used in your place of employment. Whether personal protective equipment is the means to protect the workers. Or safe work practices and procedures. Now, these aren't just left by themselves. A lot of these work and coincide with each other. So standard practices that also incorporate universal precautions. A lot of these different measures are not, as I said, one shot only. It will be a combination of engineering controls and personal protective equipment. It may be a combination of safe work practices and procedures and engineering controls, or it may include all of these different points in your exposure control plan. You must also identify the limitations in infection control measures previously described. So certain things such as engineering controls are your guards, your barriers, your shields, but you also must describe in that plan the limitations of those shields, of those protective measures, of those physical barriers. As well, in that plan, we must set out the procedures to be followed in the event of these following circumstances. If there's been a spill or a leak of an infectious material or organism, how is the workforce going to deal with that situation? If a worker has been exposed, and if a worker believes that he or she has been exposed, in that documented plan that we're going to, again, reach into a little bit deeper today, these procedures must be clearly identified within that plan. How are you going to deal with each of these different situations as they occur? The documented plan must also set out and clearly describe the methods for cleaning, disinfecting, or disposing of clothing, personal protective equipment, or other equipment contaminated with an infectious material or organism that must be followed, and indicate who is responsible for carrying out those activities. So again, your plan needs to be fairly inclusive. It needs to have a lot of information in it so that people aren't wondering, well, whose job is it to do this? Who is going to take on this role? Who is going to take on this responsibility? The plan must also describe the training to be provided to workers who may be exposed and the means by which this training will be provided. So in that plan, it must document what type of training is going to take place. Is it going to be an all staff Zoom meeting? Is it going to be provided through email documentation, through an online learning platform, through the sharing of videos that also have some sort of way to confirm that the workers have received that training? That plan must describe those components. Also, the plan must have a process in place to provide for the investigation and documentation in a manner that protects the confidentiality of the exposed worker of any work-related exposure incident, including the route of exposure and the circumstances in which the exposure occurred. So your plan must make reference to or include a document or an area where that investigation can take place. Must also require the investigation of any occurrence of occupationally transmitted infection or infectious disease to identify the routes of exposure and implement measures to further prevent infection. So if there is a infection on the place of employment, that exposure control plan must have a process in place, not only with the investigation of the previously mentioned, but how to then come up with corrective actions to prevent that infection from further infecting others on the job site. So this plan, of course, is not specifically written for COVID-19 and for pandemics. This plan is written for exposure from blood-borne pathogens, from other biological substances and stuff found within a workplace that or may be encountered in a workplace throughout the normal course of activities. So these plans can be a template of such, which we're going to share with you later, that can be used and modified to work with a number of different situations that may be encountered throughout the course of employment. Number 4, I didn't lay it out, but it's a compliance declaration, and it talks about the date in which this regulation came into force and the date in which that any employer who does encounter these situations needs to have an exposure control plan. Just know that those dates that are listed are from years past, so we are currently at the point where anything beyond the date that was listed, and in here, anytime after no later than January 2006. So we're well past the point where the exposure control plan would be required to be developed by employers. Number 5 says no employer shall allow a worker to undertake any tasks or procedures mentioned in the previous clause 3C. Now, clause 3C, if you were following along, spoke to the identification of the categories and tasks and procedures that may put workers at risk of exposure. So no worker shall allow a worker to undertake any of these tasks or procedures mentioned in that subclause or in that clause, unless the worker has been trained with respect to the exposure control plan and the use of control measures appropriate for the task or the task or procedure taken. So like everything with fall protection work plans and a number of other plans that are put into place to prevent workers from encountering those situations, the worker needs to be trained, informed of those plans. They need to be readily available for the workers so they can identify what needs to be done and what needs to be done to protect their health and safety before they're put into that position where they may encounter that hazard. 6 is an employer in consultation with the committee shall review the adequacy of the exposure control plan and amend the plan if necessary, at least every 2 years or as necessary to reflect advances in infection control measures, including engineering controls. We're going to talk about this a little bit later when we discuss the exposure control plan and the development and use of the template. But this clearly lays out that at a minimum 2 years, or if advances in infection control measures and engineering control measures come into place. So what this says is that as things change within our province, within the country, as far as different directives and such, we need to be making sure that this plan is being modified, changed, redeveloped, and reviewed as necessary to make sure that we're keeping in touch with those plans and moving forward. Also, as I said earlier, the employer shall make a copy of the exposure control plan and any amendments to the plan readily available to every worker who may be exposed. So a lot of times we have run into this with other situations, and I'll keep referencing back to fall protection. If you ask a worker, where's their fall protection work plan? And they say, well, I believe it's back at the office. Well, within that regulation and this regulation as well too, it makes reference to readily available to every worker who may be exposed. It's no good if the plan is 4 hours away, locked in a filing cabinet, if the workers need to resource some of the control measures or some of the steps that are laid out in that plan. It needs to be there so that they can use it, resource it, find out the information that's contained within it. Part 8, every employer shall inform workers who are required to handle, use, or produce an infectious material or organism, or who may be exposed at a place of employment, of any vaccination recommended for workers with respect to the risk in the Canadian Immunization Guide published by Health Canada and recommended by. Now, I've left the rest of this regulation. I wanted to stop there, and we were going to review a little bit of it verbally. It became quite a bit to try to include into the PowerPoint because there is a number of other components that tie into the end of this. Mike, were you able to jump in here for a bit?
Yeah.
Did you have some of that stuff ready following this section?
Sure, Bill. Yeah. When it comes to vaccinations, there is number 8 when it comes to, and I would really encourage anyone that's going to go down that road that in their workplace they need to look at vaccination as a possibility for going back to work or any of that stuff, that they look at regulation 85.8, which is being referenced here, and read the details of this, because it does talk about having to do it during work hours. If there's immunization that's going to be needed, that a worker would be paid to go and get that during work hours, or if they had to coordinate it outside of work hours, that they would still be paid for their time during this as work time, as it's a requirement of their employment. So there is some detail in there, and I would definitely encourage to dig into it, because we are I think the vaccination or the vaccine kind of a topic is a broader topic at this point. So just to touch on that.
Yeah, thanks, Mike. Yeah, as Mike said, it's something that definitely requires, if you're whatever the future holds as we go forward, if that becomes a option or a suitable option for your place of employment, to read more into that specifics that are found in that section 8. You could almost do a webinar just on the remaining components of that section, but knowing that it is your responsibility as an employer to make sure that you review the information that's applicable to that, and make sure that that's part of your plan as required, if that's the way that you plan on moving forward. So that was a lot of regulation, and even broken up into bite-sized chunks. That was almost a page and a half, physical page and a half worth of stuff, tried to slide into a few different slides. And we answer these questions all the time when it comes to what does this mean? How do I implement this? How am I going to move forward putting this plan together with my place of employment? That's great that there's a clear written requirements through the regulations, but what does this mean to me on site? What does this mean to me as I'm trying to help my workers, as I'm trying to work with my committee and put this stuff into practice? So broken up into a couple of steps that's going to help you put stuff together. And we're going to have some general conversation around these steps and what that can look like on your job site. So with everything, the first step is to assess. It's very difficult to put controls into place unless you know what you're actually trying to control. So you need to do a workplace assessment. As the regulation said, to engage with your OHC committee or representative or workers at that place of employment. So you get a very good, clear understanding of what's happening at the work site. I'm sure any one of our panelists can speak to what happens when hazard assessments or workplace inspections are conducted by a single person. You tend to get the view of a very, very narrow view of what the activities are. You don't get a wide picture. You don't get the full picture. So we want to make sure that we're conducting hazard assessments of the work areas and of the tasks being completed in those work areas. When we're looking at those gathering spots, right? So in my head, I come up with the lunchroom, right? Where workers are going to congregate, where you may have a number of employees in the same location at the same time.
Yeah. Bill, just to jump in there,
Absolutely.
you know, that what a great topic, what a great place to start is with workplace assessment. And what this does essentially it does control different areas, different aspects of your operation. But in relation to our day and times and that we're in and stuff like that, and all the hype up about you know, people have a lot of fear and stuff like that when it comes to you know, COVID-19, and that when workers see this, when they see the employers putting in efforts to assess their conditions, to assess their operation, to assess their procedures and all of that, then honestly, as a worker, you can take a lot of you know, comfort that the employer's looking at all these things. And then that's your opportunity, like you said, engaging workers, to then get engaged in that process and say, okay, well, what about this scenario? What about this situation? So that workers don't just think they're going to work in an unorganized fashion when they have this thing going on. They know that there's a plan in place and really can settle them into, okay, I work in a work environment that's really going to deal with the things that are top of mind to me and the hazards that are associated to this. So yes, an exposure control plan is brand new in relation to COVID for the workplace. But the reason why OHS is putting this in place and making this mandatory to do this specific for COVID-19 right now is because it's needed. Like you need to do it now, right? Like you need to at least put a plan in place specific to this hazard. So, sorry, I didn't mean to go a little bit off. I just didn't want to get too far away.
I think as well, Mike, you alluded to a very important point, though, is something that a lot of workplaces are dealing with is the mental health of employees, right? As far as for promoting positive mental health, if your voice is being heard when it comes to concerns, especially during the development stage, you have some buy-in, you have some reassurance that your concerns have been noted and looked at and possibly made into components within that plan, or at least control measures have been brought forward to help you deal with those certain things. But yes, what a great place to start. Get the workers together. Make sure that everybody knows what's going on too. I think maybe even step 0 on this is to inform the workforce as a whole that you're looking at this plan, that we're going to start moving forward. We want to do everything that's reasonably practicable for us to protect the health and safety of you while you're at work or at your place of employment or otherwise. And invite that feedback right off the bat. Invite that open lines of communication. Again, I know I always feel better mentally if you have the ability to take part in the development process of something, whether it's the development of this plan or other things. It does increase your mental health. I think I don't even think, I know it has a positive spin-off for those components. So
yeah, and in addition, sorry, I don't want to beat this too much, but in addition to that, this is a great function. If anyone's ever wondering, hey, what's the deal with an OHC? What's their actual purpose and function or the rep in my workplace? They don't even understand what there is. Well, when this exposure control plan comes out, it's reviewed by the OHC, or they're probably involved in the process of developing this. So they can give you a point of contact as a worker as well to say, okay, this is where I can funnel my information through, instead of having too many hands in the cookie jar where everyone wants to be involved and everyone's going on left field on, you know, on things that they think are important. They can funnel some of that stuff through their OHC member as well. And then that can be, you know, considered when they're developing the plan. So
yeah, you know what, and that's true. We talk to a lot of companies that are going through core processes or otherwise. When the question comes up, what are some of the activities of your OHC committee? Again, this is a strong point where that OHC committee can become more effective, can raise their level of visibility within an organization and workers to show that they are here to help protect workers on the job site. So back to a couple of points on the slide, like we said, identifying common gathering spots or lunchrooms or otherwise. Looking at public contact locations. Do you have the public coming into your facility? Where are they entering? What type of surfaces will they be touching? What type of needs do they have? Do they have to sign documents? Do they have to leave products? Do they have to pick up materials or products? And again, what are those areas? And clearly identifying those in the assessment. Another thing to look at, as we said, not just looking at the work areas, but looking at common shared tools and equipment. We can even take, for instance, when we developed the plan for the office in our association and our facility here in Saskatoon, identifying what are some of the common areas. Well, the photocopier, right? We have all of the staff that are in the building at one time or another need to go and print something or fax or receive something from the photocopier. So that is a common area, a common component that is touched. So we want to make sure we identify those within our hazard assessment process. Do a real good deep dive. Now, when I talk about shared tools or equipment or other common contact surfaces, something else that can help guide you to this is, I mentioned earlier when we were talking about our website in the COVID-19 resources tab, within there is a surface contact sanitization checklist. Now, that checklist right at this moment is not part of the hazard assessment process, but what it can do is give you a list of common items found within workplaces that you may or may not have thought about while you're developing your hazard assessment process. So it gives you kind of a guide to help go, oh, right, I forgot. We have 4 people that play with the thermostat every day because they're either too hot or too cold. We need to mark that down as a common area, as something that we need to identify through our hazard assessment process. We've completed the hazard assessment process. We've documented all of those common areas, the common tools, the common surfaces, any of those locations where workers may encounter the public or where they may be in close proximity to other workers. We've documented that all. We've identified those and we've come up with all of that situationals. Now we need to come up with the controls. So we've said that 12 people a day touch the photocopier. What are we going to do about that? How are we going to protect the workers that all encounter that common location? So when we're looking at these, using the information gained from the hazard assessment process, we're going to determine some of these best controls based upon public health orders. We could just say that we're going to do this, but unless you actually consult what are both our federal and provincial public health orders, you may not be actually in compliance with those. So make sure you look at those resource information when you're putting these controls together. So you have the most, again, current up-to-date information, and you could put that into play. You're also going to want to look at industry-specific guidelines. As some of these orders come out, or as some of these guidelines are released from, again, both our provincial, federal, or our health authorities, we want to make sure that we are making our controls based upon the information if there is stuff that is very directed to our place of work, to our operation, to our organization. As different places and different operations are clearly identified in those public health orders, again, we don't want to go all the way down doing all of this work only to find out that we missed out initially because we didn't research far enough or further enough into those controls to make sure they're in compliance with not only regulatory information, but with public health orders. As well, we really truly want to look at the hierarchy of controls. I have a little image that's going to pop up here in this after we've talked about the application, but we need to look at how is best to protect the workers. This hierarchy of controls is something we speak about at all of our training, within our toolbox talks often, within our webinars. The ability to look at a hazard and determine the best control strategy based upon that hierarchy. And as we know, as we can see here in the little illustration, elimination is that best possible strategy. If it is not a hazard, if it's controlled by eliminating it, then we know that we've done the best possible thing we can do to try to protect those workers. Sometimes though, elimination is not practical. We can't eliminate certain tasks. You can't eliminate certain functions within a place of employment. So we have to start moving forward through that hierarchy to find the ones that best apply and provide the highest level of protection to the workers. And again, these aren't just one size fits all. It may be a mixing of administrative controls and engineering controls. It may be a mixing of personal protective equipment and engineering controls. So you might have physical barriers, but you also might have physical barriers and a requirement for the use of protective hand, like gloves or otherwise, if it's a certain area, a certain common touch spot, or something that may have the ability to transmit through contact. So we want to look at not just this, but we want to look at what is best. As I said, worksite application. You could build
Bill?
a giant. Yeah. Yes, Mike. Absolutely. Step in.
I'm sorry to interrupt.
No, you're not
I
in
just
trouble at all.
do you want to go through a couple of the examples of what some of this stuff would look like?
Yeah. Well, so
Sure.
our-
I can do that. I can even do
Yeah,
that if you like.
sure.
So
Jump in a couple of them.
yeah. So for example, of an engineering control, you know, if you cannot maintain physical distancing, install barriers and partitions to separate people, for example. So, you know, a small checklist might say, you know, we have installed barriers in situations where workers can't keep 2 meters distance from each other, customers or anyone else. We have included barrier cleaning in our cleaning protocols. We've installed the barriers so they do not introduce other hazards to the workers. For example, barriers installed inside a vehicle don't affect the safe operation of the vehicle. So really putting in control measures that are trying to, you know, engineering some control measures that are trying to eliminate that hazard altogether.
Yeah, absolutely. And a lot of these, some of them, even if we're not looking at physical controls, if we look at administrative controls in situations for the purpose of the exposure control plan, administrative controls can be reasonably functionable, but again, they often work in conjunction with other controls. So, you know, policies and procedures for hand washing, you know, things like that. Those administrative controls can say, okay, anytime that you enter the building, you mandatory sanitization. Those type of procedures, again, will they proactively prevent the spread of exposure? Absolutely, they will. Again, just using those type of things. Sufficient cleaning, frequency of cleaning, schedules for sanitization of locations, sufficient cleaning materials, an inspection of those things as it's being conducted, making sure that that's being done. Clearly communicated guidelines, all of those type of things. Make sure that, again, the application of these controls is going to be effective for the workforce. We need to develop policies around this. It's not so much that you're just going to develop a one pager and push it out, because there's a number of different things that are going to come into play. So when we're looking at policies, we're going to look at a workplace entrance policy, right? Who can enter the building, when they should enter the building, when they should not enter the building. Is there going to be pre-screening for that policy for workplace entry? Is there going to be sign-in and documentation to potentially help with contact tracing in the future? Are there going to be a number of different things for public entrance? Are we going to provide public access to the building? Are they going to be allowed only in certain restricted areas? A lot of those are going to be part of your policy development. You're going to sit down and not only develop your physical barriers, as we said, or your PPE or your substitution and those type of things. You have to look at the policies around hours of work, employment entrance, all of those things. Also, and a policy that coincides with some of the documentation on exposure investigation. If we believe there was an exposure in the workplace, or there was a suspected exposure, or a worker became ill in the workplace, how do we investigate that? What's the process? How is that going to be reported? Who is going to receive the initial report? How is that going to be communicated to the workers following up the investigation? What are the control strategies? How are you going to put that into place with that exposure investigation? Also, the procedures that, as I said, what happens if a worker after lunch who came in the morning was feeling, fine, and then by 1 or 2 o'clock in the afternoon, they start to see symptoms? What do we do then? How do we protect the workers? How do we make sure that that worker who is showing symptoms gets the assistance that they need while still ensuring the safety of the workers in that place of employment? Is there a policy for a dedicated isolation room with contact information? How is this going to take place? How are we going to work our way around it? The old adage of if you fail to plan, you're planning to fail very much follows through with these policy developments. If you don't have something in place, When something does happen, you'll be scrambling. You'll be running around going, okay, what do we do now? Who do we contact? Phone the manager, phone this, phone that. And whereas if it's planned throughout not only the developed the exposure control plan, but proper policies that are also coincide with that plan, it'll make it a lot easier for workers to understand what is going on and what to do in the event of these situations.
Yeah, and like just to add on to that, sometimes we're talking about an exposure control plan, and we're going to show a document that we've come up with that goes through a lot of the details of this. But a lot of times when you're coming up with your plan is more than one document. Like what you're going through right now, it's an amalgamation of different strategies, the sanitization checklist, the different policies you have in place and stuff. So you could even make a section in your safety manual or your safety program for exposure control, and actually have reference to all these other documents and policies that all are in relation to this to compose a rounded plan for your company.
Yeah, very, very good point, Mike, is that this isn't the exposure control plan is not just a one-page document that has a couple of points expressed in it. It's going to reference, to make it well-rounded, as you said, it's going to reference the use of a sanitization checklist. It's going to reference the use of an inspection investigation document and having those documents to coincide with the plan to make it an effective, usable program as such. I mean, if we want to try to expand, it is going to be much more than just a one-pager. So with everything, it's only as good as you can communicate it, right? You could put in the best plans, the best programs, have all the best documentation in the world, checklists and forms and all sorts of stuff. But unless you actually let the workforce know about it or make sure that they're aware of it and they understand it, then the program won't function properly. The plan won't be effective to prevent exposure to the workers. So we want to train staff on those controls and those procedures. And that training, as we said earlier, it popped up within the regulation as a requirement. You want to make sure that the workers understand what is being provided to them. A way to somehow receive some feedback that they know what these plans are, that they know what these procedures are, that they know how to properly fit and wear a mask, or the times when those are required, or proper hand washing technique. Again, that may be all part of the plan. That may be part of a extra section within the plan talking about the practices and procedures and the control measures that are into place and how to apply those appropriately. Public and staff signage and posted. Again, reinforcing the information found within that plan, making sure that one thing that I just want to touch on while we're on here is signage needs to be clear, and it needs to be very, very, I'm not going to touch too much on the situation, but I was in an area just last weekend where following full precautions as we normally have, and in a retail environment, and then was told by the staff member behind the till that I didn't follow their plan, or I didn't follow their procedure. And I asked, I'm sorry, I don't understand. I wanted clarification. Well, he says, well, it's up on the sign just above that area. And I looked, and the page itself was in probably 10-sized Arial font text, and it was a whole page full of information that was 8 feet off the ground above the area to which I had entered. And I very quickly, I said, I'm sorry, I apologize. I didn't notice the signage was not clear. I just wanted to reinforce that, like, if you're going to be putting information on signs, on information for people entering buildings, a giant one-page document that's got 10,000 words and 7 paragraphs into it is probably not going to be effective. Really look at what you have posted in your workplace and make sure that it actually provides an effective means of communicating that information, whether it's clear, concise, readable, in an area where you're going to walk in and it's going to be in front of you. You have no other choice but to review the information. So it's important that you look at what you have posted around the workplace and make sure that it's done properly and it's done clearly. I think it's hugely important, especially at this point in time with so many different procedures and plans in place for different places of employment, different outlets, different locations. It needs to be very clear to the workers. So I saw, Mike, you wanted to make some mention on something.
Yeah, and also like signage doesn't replace training. Signage,
No.
I think, is what it does is it can reference. It's kind of like going onto a site and the sign says you must have orientation prior, prior to entering a site. Go directly to site trailer. Like
Yeah.
that's a good sign because it's telling you, okay, well, I can't do anything. Stop in my tracks. It's very clear. It's very easy to read, and it's very pertinent to the entrance of the site.
Yeah.
You can't have a training program to say, oh yeah, I know all our workers were trained because I hung a sign up or I posted something on the safety board. It's just not going to be adequate. What they're going to do is they're going to reference training. They're going to reference, requirements in certain areas if there is, and it's going to be specific to, the location. For example, going into our office at work, there's clear signage, and we have a doorbell actually that notifies people inside, so we don't just have people walking in off the street. It says, and prior to dinging the doorbell, like the signs there, you got to read the sign so you understand even that you need to ring the doorbell and stuff. So some of them have more information on them, but the ones that have a lot of information on them typically are going to be the ones that, you need to read. It's kind of like a direction before you can move forward, but it's definitely not training. It's just more of an indicator.
Absolutely. Yeah. It's part of the communication strategy, right? That coincides with that training. Once the training's been completed, just keeping it forefront in people's minds as they walk in, like I said, to areas and such, going, oh, yeah, right. Remember, have to do this every time we're in here. Yeah.
3 people allowed in the lunchroom at a time, that kind of stuff. So it's right on the door, right when they're going in, and they see 3 people are already in there. It's just another one of those, keeping people so they're informed without having to memorize the whole thing at all times, kind of thing.
Right. Absolutely. Also, one thing that into here in the training and communication, having your supervisors trained to monitor the controls. So not only as far as enforcing the control measures, right? Making sure that the employees themselves or otherwise are in compliance. Oh, you need to make sure that this is being done. Oh, did you remember to do this before you left the room? Did you sanitize? Those type of things. But also just monitoring the effectiveness. Making sure that they understand what they're looking for, right? Is this actually an effective control? Or did we maybe need to go back to the committee and look at this control strategy? And is there a more effective means to properly protect the workers at that point in time? But it needs to be somebody that is kind of tasked with doing that, right? Everybody has the opportunity to identify workplace hazards. Everybody has the opportunity to bring those forward, but supervisors need to know that they're monitoring those controls. They need to know that, okay, we seem to have a problem with this area. A lot of people don't either understand or otherwise. So is our signage not working correctly? Is this, can I take that to the committee and further on?
Yeah.
And
I'm going to add on that. So if you put into your policy that no worker will ever be within 6 feet of each other, like a supervisor is the one that's going to pick up on that. And honestly, if a supervisor doesn't do anything about it and the plan says that they're not allowed, yet the supervisor says, hey guys, go into that work basket there on that scissor lift and go install that light bracket or whatever it is. And the supervisor actually goes against the plan, puts these workers in that situation. It actually kind of falls down onto the supervisor's shoulders that the plan wasn't being fulfilled the way that it was written. So I think the supervisor has a high stake in these plans and needs to understand that if the controls aren't appropriate and they can't work with the controllers and the workers can't work with the controls, that they need to be modified because really everyone signed off on it. So it's very important that they realize that it does fall on their shoulders big time.
Absolutely. Yeah. The last point on this one was just a system in place for delivering feedback. Not only that the supervisors are monitoring it, but as I said, the workforce, everybody in the place of employment and otherwise is going, and keeping note mentally or otherwise of what is going on. Are these control measures effective? Do we need a way to improve on them? And how do I get that through? How do I provide that feedback? So that comes into, again, making sure that the workers know who their OHC representatives are, who their committee members are, and or if the process is to bring concerns to the supervisor and the OHC, and as well toolbox talks. You know, your daily tailgate meetings, making sure that you leave not just anybody see anything wrong with today, yep, move on. But how's everybody doing with these control strategies? Are they working? Is this working out good? Does anybody have any suggestions that I can take forward today following this meeting? Those type of things. And of course, as the regulation said, posting or making available the document readily accessible to the workers. Not only are they trained and there's signage to help communicate and all these different steps in place, but being able to go back and reference that plan if any questions arise, right? As a worker going, geez, is this the right thing that we should be doing? I should check the plan. You should be able to know where to find that plan and how to get a hold of it. When we talk about the last step of this is monitoring and following up, kind of closing that loop again, consult with the OHC committee for worker feedback or the representative. Make sure that the employer, or if you are developing this plan, you are talking to your committee members. You are engaging your committee members, whether it's representative chairs, co-chairs, and getting that feedback from the workforce so that you can say, okay, as we've talked about, this plan is either effective or it needs work. Also, make sure your policy and procedures are changed as needed. Don't wait for a 2-year frequency to change the policies and procedures. If it's ineffective, change the procedure, change the policy, inform the workers, monitor that new changes, follow up again, and make sure that those changes are effective. Looking for changes in work. The tasks may change. On a construction site, the tasks change daily. What was a one-person operation all of a sudden has 7 people in that same work area now, or that same work site. So how do we then modify? Does the plan include for the changes in the work? Does the plan include for sub-trades entering the facility? Does the plan include for contractors arriving for inspection purposes, those type of things? And again, as we've made mention a few times, make sure you identify changes in provincial or federal health orders. It's no good that your plan was developed in March, because we all know that things have changed drastically since March as far as what should be done to protect workers, what's going to be done in both our provincial mandates and our health mandates. So make sure you're staying on top of what is being said, what is being released, and what is being put into play and into action, because that will have a direct influence on your plan. Just wanted to leave Kieran a few minutes to talk about his developed plan. Any more information and resources available on our website. Again, keep checking the website. Things are being updated as much as possible as we get new information and you find current and good stuff going forward. So with that, I'm going to stop out on the share here. Yes, Mike.
Okay, so that's our website. I want to give a pathway to that. Just go to resources on our website and you can find all these like the sanitization checklist, and you'll be able to find the document that Kieran's going to go through here. We'll be posting it on there once we finalize it. And that's as well on our website, you can phone the 1-800 number and contact and just ask for an advisor. If there's a company out there that wants some assistance with control, exposure control plan, talk to one of the advisors. We can help set you up, get you some documents, chat with your specific situation. And then the very last thing I want to reference before we give it to Kieran, Bill, is the WorkSafe Saskatchewan website has a really good document or layout for conducting a hazard assessment and developing an exposure control plan. So that's worksafesask.ca, and then COVID-19, and then conducting a hazard assessment. You'll be able to find it on their website, and it's just a great document. It has some links in there to regulations and different things. So,
yeah, thank you, Mike.
Yeah,
Kieran, are you? Would you like to share with us the document?
Yes, sir. I'm good to go here. So we'll just start the screen share process up here. Gentlemen, I'll just ask if you can see my screen here.
Yep.
You bet.
Perfect. So this document we've developed and updated, just as Mike and Bill had alluded to, forms not being good if they're from the past. So we updated this one to the most recent information, as well as have all that legislation that's in there. So if you look at this form, you'll see a query, which is basically just a question. And on the right here, you'll see a blank space where you have to customize it to your company, because in any situation, a form that's just blanketed or boilerplated, as a lot of people would reference it, they're not going to work for your specific industry or your company or your work sites. So customization is key here.
So those query questions, those are directly from, where did you get those query questions, Kieran?
They're directly from legislation. So it references all the points in that section 85, goes down the list on the left here. And it asks for the things that the legislation asks for, which makes it simple to put stuff in here. So it can be treated as a living document where you put the most recent up-to-date information in here. If you don't, you'll have a chance that workers won't be updated on the things that you've put into place recently. So with all that being said, I've included a few different things. So at the bottom here, there's a review to ensure that different members of the company, different stakeholders have put their pieces into here and reviewed. It is required, as per that legislation, to have the Occupational Health and Safety Committee or representative take part in the phases of planning this out, and they must be part of it. So at the bottom here, there's also a disclaimer, and within the disclaimer, you'll read the basic legislation. No worker shall do a task without training, but it also has the reference to the website that Mike had talked about. So if you click there, you'll find that website that gives you a very good understanding of how to fill this document out, steps to do before planning and everything like that. So it's a huge help to have a resource like that in developing something so new to everybody. And I think that everyone will have a slight struggle to fully understand this, but with basic training of our workers in this plan, we'll get a way better understanding of not just the plan, but everything that we put into place.
Like Mike had mentioned, sorry.
Yeah, for sure.
Like Mike had mentioned, the being able to contact advisory services or the association through our 1-800 number or email, and then have an advisor reach out to you. They will be able to help you with the development of that plan, as far as some information, and as well that document that's not only linked in there, but Mike made reference to. It provides you some very clear directives. It isn't itself an all-inclusive plan, but it does help you put together that plan. Some of that information you will need to make sure that it gives you it's a kind of a checkbox to making sure that you've covered all of the aspects that are required within that plan.
For sure.
Yeah. Otherwise, unless somebody has something they'd like to say in the last minute, I believe we've reached our 1 hour time limit here. And I'd like to thank those that joined us today. And if you're joining us at a later time, taking a good look through this and having a part of the conversation with your workers and your workforce when you go forward. But otherwise, I would, again, thank you for attending. Check our website for more information. Feel free to contact us at any time.